Doc.
Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Hello, Doc. Hello, Doc.
Hello, Doc.
Right, but before we continue, please note that today's topic we are about discussing is a bit or maybe a bit sensitive or emotional for some of our listeners. So our intention is just to inform and educate, but then if at any point you feel a bit uncomfortable, then please do take care of yourself in a way that you may feel right. But then remember today's topic we're discussing is erectile dysfunction and male infertility. Let me welcome Dr Emefa Dzide. Doc, good afternoon.
Good afternoon.
How are you doing today?
By God's grace.
Thank you so much for joining us once again. So a very sensitive topic, but a very insightful topic we have this afternoon. So we go straight to the discussion. Can you explain what erectile dysfunction and male infertility is?
Okay. So let me start from male infertility. So if as a man you are trying to conceive, yes, and after 12 months of regular intercourse, that's at least twice a week, yes, you are still not able to conceive after about 12 months, then we would now define that as male infertility. Yes, or if the female is above the age of 35, that one we give a smaller window, 6 months, yeah, because of the age of the woman. Yeah, so basically that's how we define it. And with erectile dysfunction, that is specifically with the, should I say, the ability to maintain an erection and to be able to have satisfactory intercourse as in to the male to feel satisfied. Yes.
Okay. Now, what are the common symptoms and signs of erectile dysfunction and male infertility that a man might experience?
Okay. So yes, erectile dysfunction is quite, should I say, sensitive and dear to the hearts of many men
and even women.
Yes, yes, but a lot of the times the men are very. That's one thing they will never lie about if they are in the consulting room, but they can lie about other things. I don't know why. But yes, so initially for erectile dysfunction, what is usually starts with the earliest signs, they will probably feel that their erection is not as firm as it used to be, and they are not as satisfied as they usually are. Yeah, and then when it goes on, it gets to an inability to sustain the erection. So they would have the erection, but they can't sustain it throughout. They would either lose their strength or they would have a premature ejaculation. Yeah, and then when it gets worse, they can just not be able to obtain the erection at all. And or they might get it, but it even goes just before penetration is able to occur. So sometimes these can go in that order. Sometimes it's variable. Sometimes he will be able to, then other times he wouldn't. Yeah, so it depends on the person. And usually the signs or the symptoms that they might have, they might be having reduced sexual desire. They might have delayed or absent ejaculations. And usually they might have other signs like physical signs. Maybe there'll be scarring. If there's actually a physical problem, there could be scarring of the tissue of the penis. So sometimes you see that a curvature is developing. Sometimes too, it's those who are not circumcised. There could be an issue of the foreskin getting stuck. Okay. So they are not able to retract it. Yeah, and then sometimes testicular issues could also be a cause. Yeah, so if you notice there's asymmetry, maybe one of the testes is much bigger than the other, or one has shrunken in size than the other, that could also be a sign. And then sometimes too is the vascular sign, so as in the abnormal blood flow in the penis. So they will be able to have a sensation that it's very weak, or the pulse in there is also very weak. And they might have emotional signs as well. They might have performance anxiety. They might get depressed, low self-esteem, relationship stress. They'll become, I don't know, irritable, getting angry and those kind of things, avoiding any sexual kind of atmosphere. And then they can end up compensating, focusing on other things rather than, so they'll be more interested in masturbation and pornography rather than the actual sexual intercourse. Yes. So one important thing to mention is if it is all of a sudden that it occurs and doesn't happen gradually, that could be, should I say, a very important red flag, and you need to see a doctor very, very quickly because that kind of fast thing can lead to an irreversible damage.
Oh, wow.
Yeah.
Okay. Now, let's talk about the diagnosis. How is it done?
Okay. All right. So the diagnosis, first we'll start with taking the medical history and then we'll move on to the examination. So the medical history, we'll talk about the signs and symptoms and also look at your lifestyle. If there's any illness, diabetes, hypertension, those are the major, should I say, culprits when it comes to erectile dysfunction.
Okay.
And then smoking, drug use, alcohol use, and then sometimes psychological issues, stress, and all those things could also be part. So it's very important to take the medical history very deliberately. Then we do the physical examination.
Okay.
Aside checking the normal blood pressure and all those things, we'd have to look at the organs themselves. Sometimes there might be some upcoming deformity, or maybe there is a trauma, or there was a trauma. Yeah, and then that could be the cause of that.
Okay.
And then normal blood tests that would be done to just see the state of the health, and then to check the hormone levels as well. Sometimes if the should I say the testosterone levels are low, and other hormones that control the release of testosterone from the brain. Yeah, so we do all those tests and then try and identify where the issue is from.
Okay.
Yes.
So what are the common causes of erectile dysfunction and also the male infertility?
Okay. So one more thing I should have added was the sperm or the semen analysis. Yes, so that's an important thing because that will give you the sperm count, the motility, or how fast the sperm are able to move, the morphology, the shape and size of the sperms, and then also look at the volume or of semen that comes out. Yeah, so all these things could also be part of the cause of those things, either the infertility or the erectile dysfunction.
Okay.
Yes, so that's one cause, and that's one thing that's very important when we are doing the testing. Yeah. So the causes, I mentioned the hypertension, diabetes.
Yeah.
Yes, those are actually the commonest causes that personally I see at the general OPD. Yes, so a lot of times these people have had hypertension for years or diabetes for years. Yes, and then it has affected the blood vessels, so they are not able to get enough blood flow in there as they should. Yeah. Aside that, there could be neurological disorders, so spinal cord injuries, something like Parkinson's disease can also cause those kind of things. Medications can also cause this. The psychiatric conditions. Oh. Yes, so the antidepressants and then the antipsychotics, quite a number of them have this side effects.
Okay.
Yes, so you have to watch for those as well. So if you are someone who is on those medications and you are noticing it, then you have to tell your doctor so that they can switch to a different medication for you.
Okay.
All right. Also, obesity is also
one of the causes.
Yes, and then sometimes sleep disorders. So if you are not sleeping well, it affects your hormonal balance, and then that could also lead to low energy, and then lead to the erectile dysfunction. All right. There's psychological causes I mentioned. If you are under a lot of stress, if you are depressed, if you have relationship issues, that could also be a cause. Of course. Yes. And as usual, smoking and drinking is always causing trouble here and there.
Trouble here and there.
Yes. Yeah. And then age also is also a factor.
Things,
yes. Yeah. So as men age, their function goes down a bit. So it's not always not a rule, but it's something that you should take into consideration. Yeah.
Okay. Are there treatment options available for erectile dysfunction and also the male infertility?
Okay. The male infertility, it depends on what kind and the level, if it's a primary infertility, secondary infertility, but you would have to see your doctor for a very, should I say, I don't want to say specialized, but specific to you as an individual.
Okay.
Yes, because every individual has different factors that are all coming together to lead to what we are seeing. Yeah. Basically, there are medications, and I know people abuse these ones a lot there. So Sildenafil, that's the Viagra, and then it's family of medications. Yes. So that one, they take it, and then it gives them the erection instantly. And it's supposed to be working for like 30 minutes to an hour or something. But you can use it, but if you abuse it, it could also lead to
other things.
So please, anytime you're taking such drugs, it should be under the guidance of a medical professional, of a doctor, not on your own, popping 2, 3, and all those things. People do that quite frequently, and it really affects them. Hormonal therapy is also an option. They can do testosterone injections or gels. It depends on what the cause of
the erectile dysfunction or the infertility is.
Then psychological counseling is also very important. Actually, most of the cases, or not most, but a high percentage of the cases have a very high psychological aspect. So a lot of times they'll be able to masturbate on their own, but when it's with their partner, they can't get the erection. So it's a lot of counseling, and sometimes they do cognitive behavioral therapy. That helps with them. Sometimes it's performance anxiety. Sometimes they already have a personal low self-esteem and those kind of things. Another solution is the penile injections. Yes.
Which one is that? Which one is that?
Yes, so it's an injection, a medication that you inject directly into the penile tissue. It works within like 5 minutes, 10 minutes immediately. And then I don't want to mention the names because some people might.
I know, right?
So
Michael is listening.
It's an option. see your doctor about it. Yes. Okay. We have vacuum erection devices. I don't know if they are available in
Ghana.
Yes.
Okay.
But online you would see maybe adverts and stuff about it.
Oh, really?
Yes. Or maybe it's my algorithm. All right, and the last one, we have the implants, the surgical implants. Yes, so they have the malleable. It's like a flexible but firm implant, so that keeps the penile tissue firm. Yes, so you can just bend it up and down to change the position. Yes, there's some inflatable ones as well. But I know they've been doing the implants. Well, I saw a study about it in Kumasi. Yes. But if they're doing it in Kumasi, I'm sure they're doing it
in Accra.
So it's been quite effective. They've had a lot of good results from that.
Now, are there lifestyle changes or habits that one can adopt in order to improve their erectile infertility or function?
Yes, of course, there's always lifestyle changes. The first is to quit smoking and to stop drinking alcohol. Yes. I know I'm upsetting some people.
Michael.
But that is actually a very, very big thing you can do. That actually can sometimes give a dramatic change. Another thing is weight management. So if you're overweight, you're obese, and you work at losing the weight, it can also help, because obesity is sometimes linked to a metabolic syndrome that causes not only the erectile dysfunction, but it causes diabetes, hypertension, and other endocrinologic. Then stress management is also very important. So you have to be able to manage your stress from work and from other issues, family issues, whatever going on. You should find better ways to manage your stress. Yes, and don't manage your stress with alcohol, because you are making everything worse. So find better ways to manage your stress, healthier ways to manage your stress. Also, your diet and exercise, which is also part of the weight loss. Yes, but it also helps to give you a good cardiovascular health and then hormonal balance as well.
Great. That will be it for today. I don't know if you have any other thing you want to add up before we leave.
Okay. Yes. So in general, men tend to try to hide these things until it gets to the very severe stages. Yes. So, but once you are feeling something is not right in your body, especially that though it's sensitive and you might feel shy, the moment you start seeing these signs that I mentioned earlier, please get to a doctor, get to a specialist or a urologist to help you to navigate and then detect what the issues are.
Sure.
Get treatment as soon as possible. The longer you wait, the further the damage goes, and then the more difficult it will be to manage.
Sure. All right. Ladies and gentlemen, this is where we are going to end Hello Doc, but then we'll come back next week, God willing. And we've been doing this with Dr. Emefa Dzide. She's the Senior Medical Officer at the Wager